This is the slide of longitudinal section of cardiac muscle taken or seen in 10x magnification. First question, how do we say that this is the slide of cardiac muscle? We can see short fibers which show extensive branching, and nuclei appear to be arranged in single and in the center of muscle fiber. This is how we tell that this is possibly the slide of cardiac muscle. The next question from the examiner will be, describe the structure of cardiac muscle in detail. Cardiac muscle is a type of striated muscle. As we know, striated muscle is of three types, which is skeletal, visceral striated and cardiac. So cardiac muscle is a type of striated muscle seen or located in the heart and also in the base of large veins that open into the heart. What is the microscopic structure? The cardiac muscle fibers are short compared to the skeletal muscle fibers. These in longitudinal section shows extensive branching. These also exhibit cross striations with a single central nucleus. But the most characteristic feature of a cardiac muscle is presence of intercalated disc. What is intercalated disc? Intercalated discs are best appreciated in 40x magnification. So let's just shift the magnification and try to appreciate the intercalated discs. So once we shift it to high power, we can actually see the single central nucleus, extensive branching pattern with cross striations seen within the muscle fiber. But as we can see, we see thin intercalated discs which represents light microscopic junctions of two individual cardiac muscle fibers. Each intercalated disc is made up of fascia adherents, desmosomes and gap junctions. So these three cell junctions make up the intercalated disc. Intercalated discs ensures that individual cardiac muscle fibers communicate with each other, which is exactly the opposite in case of a skeletal muscle fiber. This is how we should describe the structure of cardiac muscle. The next possible questions will be, how do we differentiate this slide, let's say, from skeletal muscle? Skeletal muscles are parallelly arranged, they are unbranched, they have multiple nuclei and multiple nuclei are located in the periphery. Smooth muscles are usually spindle shaped, they have an elongated nucleus in the center and there is characteristic absence of striations. This is how you should describe the structure of cardiac muscle and compare the structure of cardiac muscle with the skeletal muscle as well as smooth muscle.